So I'll go over what types of scar patterns are used for breast lifts. And oftentimes we combine a breast lift with a breast reduction in order to get a nice aesthetic result. So the first type is probably rarely used, and that's a circumareolar mastopexy. Some people call it a donut mastopexy, where we have a scar that goes just around the areola and no vertical lines or no other really visible lines. The really nice thing about this is if you heal nicely, if the scar heals well with the areola, it's almost imperceptible. You can't see a really significant scar of any sort. The bad part about that type of breast lift or mastopexy is the amount of lift has to be fairly limited. So it's good for somebody who's a little bit droopy, but not ideal for a patient who, say, has significant droopiness. It can be combined often with a breast augmentation procedure. So if you had a bit of droopiness, you increase the size of the breast, you still have a small amount of droopiness, you can go around the areola to help reduce the amount of skin and improve the overall appearance of the breast. That's called a circumareolar mastopexy, and it's uncommon because not many patients have a small amount of skin. The next and probably the most common type of breast lift that we perform, and I think most plastic surgeons perform, is a vertical breast lift. A vertical breast lift is a scar that goes around the areola and straight line down on the breast. And for that reason, some people have referred to it as a lollipop lift or a lollipop breast lift. I think it's probably the most popular because most patients have a moderate amount of breast droopiness, and it allows us to lift the nipple from a low position to a much higher position, as well as shape the breast both medially on the inner part as well as a little bit laterally. The last type of breast lift that we do is called a mastopexy. It's called an anchor mastopexy, and that's because the scar looks like an anchor. It goes in a circle, straight line down and underneath. The term we use for that is called a wise pattern mastopexy or a wise pattern breast lift. The bad thing about that technique is it has an extra scar that goes along the fold. However, for some patients, it's really necessary, particularly if the lateral part of your breast is starting to blend in with extra skin from the axilla, from the armpit area. Now you basically need an excision of this tissue, which is almost outside of the level of the breast. And so usually we liposuction that down and convert our breast lift into a wise pattern that extends all the way out here, which helps us clean out that lateral area and help create a nice rounder shaped breast.